Practitioner. She has turned into a certified health coach and is the founder of Nourish Health Coaching. Sarah empowers Christian women to restore their vitality at work and home by improving their gut, hormones, and metabolic health. Beyond her professional endeavors, Sarah finds fulfillment as a devoted daughter of God, a wife to her husband Darby, and a mother of 5 energetic boys, aged 11 through 19, and has recently become a grandmother as well. Together, they call rural Nebraska home. Central to Sarah's mission is the belief that God wants us to be healthy in our bodies and free in our minds to fulfill our life's purposes. She teaches by the principles of Romans 12:2 and John 10:10 that God desires us to be transformed and live abundantly. Her 12-week program will guide you in gaining health, losing weight, and growing closer to your Creator. She is a genius. I send a lot of patients her way because she does a lot of out-of-the-box thinking and can give you really practical suggestions on nutrition. It's difficult to find those things in today's world, so please help me welcome Sara Paxton.
Today I want to talk about 3 things that I am extremely passionate about, and that is our metabolic health, our gut health, and hormones, okay? And we're going to try to talk as briefly as we can on each of those topics and how they relate to cancer. So we'll get right into it. So I'm Sara Paxton, as she said, founder of Nourish Health Coaching, and we really work on mindset, spiritual, and nutritional wellness. And those are my husband and my 5 boys. That was about 6 years ago, so I'm about the shortest one now. And we added a little girl to the mix. So yeah, my oldest boy just had a little baby girl, so that's been awesome. But I graduated with my doctorate of pharmacy in 2003. And then it was, I had so many close people to me get cancer. So I had my little 8-year-old nephew die of cancer. I had, it's still really hard to talk about. And then I had my good friend Jenny and my brother-in-law. So it just became a very passionate topic for me because I kept questioning, why is this happening? And so I wanted to just seek alternate ways of helping with cancer. So anyways, I ended up getting my certified in health coaching in 2018. I, again, really work on gut health, prediabetes, diabetes, cancer, and then I just became hormone coach certified in this last year. So I really no, you're doing great. Yes. So I really talk about functional medicine being, I'm very passionate about that, about root cause medication. Because what I found in the pharmacy world was that so many times we were covering up symptoms. You guys, there's many, as many of you know, life-saving medications in the pharmaceutical world, and I loved that. But also, a lot of times we were covering up symptoms that were trying to tell us something about our bodies, right? And so it just kind of became more of this revelation to me, and I really think it was that, just a revelation that we were using Band-Aids. And so again, there's many great things, but I just wanted to go into what is going wrong with our bodies. So for example, like colon cancer, you can actually just go back for just a little bit longer. Colon cancer, obviously the cancer can start years before we actually know it, but maybe I would have somebody come in dealing with constipation or diarrhea or abdominal pain, and immediately what was I giving them? I was giving them Miralax or Bentyl or X-Lax or something to help with that, what I thought was helping, when instead I started questioning, why are they having this? Because my friend Jenny, she was having all of those things, and colon cancer took her life. And it just became kind of the norm for her, and then it just progressively got worse. And so that is where really kind of light bulb came on with me. So we have to always ask, what is the root of this? So I talk about the three-legged stool of health, and if you have one of those three legs, one of them being hormone, gut, and metabolic health, if one of those three legs is off, we really just don't have good optimal health. So that's what I'm really, passionate about, is we have to get that stool to be sturdy so that we can, just really live and have healthy lives. So gut health and cancer, a lot of people don't know what gut health is, but I usually say it's so much of our lives and our health and our vitality rely on the smallest organisms possible. And so what that is called our microbiome. So if you see this picture of the body, and I don't know if you can kind of tell from where you're at, but there are more microbial cells in our body than our own cells, which is pretty crazy, right? And so we have to really take care of these microbial cells. So when we talk about our microbiome, we have to talk about good bacteria and bad bacteria. And we all have a little bit of both. But the hope is that we have a lot of good bacteria, good in number and diversity, and very few bad bacteria. So when we have, as you can see the picture on the right, the very right, the circle, that is a high number of bad bacteria, and that's called dysbiosis. Okay, we're going to talk about dysbiosis in cancer real quick. So when we're talking about, we're going to start with the good guys, the microbiome. So a ton of these bacteria actually help us to live, okay? And so it's really important. They help with bodily functions, and we have this symbiotic relationship with them. So basically, we house them, we give them food and shelter, right? And they make us feel good. And how do they make us feel good? Well, first of all, they help us to absorb nutrients, which we need to feel good and have good energy. But one of my, the most, I think, great things about these bugs is that they provide neurotransmitters. And neurotransmitters are things like serotonin, dopamine, and GABA. Serotonin, you've probably heard of it. It's like our feel-good hormone. It's what makes us, feel good all the time. And dopamine helps us with like focus and control. And we talked earlier about that brain fog thing. A lot of times dopamine has a role in that. And then GABA is kind of our anti-anxiety neurotransmitter. It just gives us feelings of calm. Okay? So also they're helping us break down food. I could go on and on about this, but we're going to keep moving on because it's really important also what the bad guys are doing. So the bad guys, they're more parasitic. So when we have bad bacteria in our gut, and it's higher in number and diversity than the good bacteria, they get the nutrients from the food we eat, right? And they don't help us to produce those good neurotransmitters. And so basically they're thriving and we aren't. So it's really critical that we work on improving that balance of good and bad. We want to remove the bad and then repopulate with the good. So a lot of times people will say, oh, well, I started a probiotic, which is good bacteria. That's what that is. But sometimes when we have such a large amount of bad bacteria, adding a probiotic doesn't help. We kind of have to go in this step-by-step process to really feel good. This is, I won't spend a lot of time on this, but this is huge. And when we go to the next screen, you're going to see all the symptoms from leaky gut. But they say 80 to 90% of us are running around with leaky gut, which is incredible to me. But if you think of your intestinal wall, basically, it's a tube, right, that's going down through us, and you think of it like a coffee filter. It's actually only one cell wall thick, which is incredible because you think of how small a cell is, right? So basically, there is one cell that is separating sewage from bloodstream. And that's critical because clearly we don't want sewage in our bloodstream, right? And that's what's happening with leaky gut. And even sometimes chemotherapy can cause leaky gut, but it's nothing that you have to, it's very reversible. We can fix it. But yeah, that's what is going to lead to the next screen. Look at all these symptoms. Things like fatigue, brain fog, skin issues, you know, worsened immune system, headaches. You guys, honestly, this was me because I had terrible gut health when I started learning more about, well, it kind of led me into also going into the health coaching and whatnot. But I was so fatigued that, oh gosh, I needed a nap every day. I was coming home from work and I was so moody, and my kids and my husband were getting the worst of me, and I just felt like I had all these skin issues, I was itchy. But yes, I had a very bad case of leaky gut, but it's very reversible, and that is, you know, my goal for people is to help them feel better through this method. So how does all of this relate to cancer? Well, just very briefly, again, we could probably spend 2 hours on this topic. When you have poor gut health, you have a lessened immune system, and our immune system is very important in the picture of cancer. You also have decreased antioxidant production, which we know that oxidation plays a role in cancer as well. We don't have as good of nutrient absorption, right? The bad bacteria get all the good and leave us with hardly anything. And inflammation and carcinogen production. Bad bacteria in the gut can actually produce carcinogens, which is, you know, cancer-causing agents. So it's a very big picture. And luckily, the cool thing is conventional medicine is really like starting to know more of this as well, and starting to use some of these practices as well. So what can we do, right? I just want to leave you with some tips today about what we can do. More whole foods and less processed foods. That's one of the big things we start with. You guys, it's not like I don't eat processed foods. And that's what I talk about in my program all the time is we have to make it sustainable. It's not like I don't have cookies, I don't enjoy the things anymore. No, it's just you learn to have this good balance. And so I usually say a whole food. If we eat more of those, it's if you can pick it, dig it, kill it, it's a whole food. If it rots, it's a whole food. I have a McDonald's Happy Meal that I've had for like 10 years that never molded, never, you know, disintegrated. So that is not a whole food. Yeah, but anyways, really like less things like ibuprofen can be really hard with leaky gut. Some proton pump inhibitors like for acid reflux, birth control can be hard as well. But also, you know, just managing stress, drinking lots of water, good quality sleep. But in my program, we really work on the 4 R's program, which is remove the bad bacteria, replace with any nutrients we're missing, re-inoculate with probiotics, and then repair that gut wall lining. So that is basically what I wanted to talk to you about gut health. Now we're going to move on to hormones, just very, very, very briefly. But most people don't even realize that this next slide, what I'm going to talk about, is even a hormone, and that is insulin. Insulin actually is our master hormone. Isn't that incredible? So if you look at this hormone hierarchy, insulin and cortisol are like at the top, and they trickle down to our thyroid and to our reproductive hormones like estrogen, testosterone, and progesterone, okay? So what makes insulin high? Glucose or sugar, okay? And so high insulin can be carcinogenic, and it can promote cell growth and proliferation. It's associated with more colorectal, pancreatic, breast, endometrial, ovarian, and prostate cancer. But you have to notice that cortisol is at the top too, and if you know anything about cortisol, that has to do with our stress. Okay, so we're going to talk about that more in just a minute. So how do we lower our insulin? Well, one of the ways when I'm working with my clients that we work to lower our insulin is exactly how diabetics work to lower their insulin. We actually do some blood sugar monitoring. We have to lower our blood sugars. And people are sometimes a little afraid to do that, but then they become almost addicted to it because it is pretty crazy how we all metabolize like carbs differently. And so when you do this program, you realize, oh gosh, like I can eat pasta in this way. You learn to eat the things like that you can eat the things that you thought maybe were bad for you, and vice versa. So it's really, I guess, very eye-opening. But yeah, if we have lower insulin, then lower risk of that cancer growth and proliferation. But also people are, you know, less inflammation, pain, weight loss, stable moods, more energy, balanced hormones, lower cholesterol. So it can be just an absolute game changer. So yeah, very briefly, estrogen dominance, again, this is kind of an in-depth topic, but I just want to talk about it very briefly, that basically estrogen dominance means that we either overproduce estrogen, and that can be from things like endocrine disruptors. Endocrine disruptors could be like a lot of the things that we put on our skin can be endocrine disruptors if they're more toxic products, but also processed foods are very, high in overproducing estrogen. But also, if we don't have good excretion, like constipation, like we were talking about earlier, like that can make us majorly estrogen dominant. And then you look at this picture here, and if you can't tell, because they're too far away, like the top line is estrogen, and the bottom line is progesterone. And so as we reach age 30, you notice that your estrogen, both of them are starting to decline, but the progesterone is declining a little more rapidly. But that's where a lot of times we really notice that gap. Our estrogen is so much higher than our progesterone, and that's what we want to do is minimize that gap to really get rid of that estrogen dominance. Because you can see the symptoms here. It's like you could have heavy, prolonged, or irregular periods, breast tenderness, mood and cognitive changes, depression, anxiety, brain fog, bloating, weight gain, fatigue, insomnia. Like a lot of people are walking around with estrogen dominance, and just little things that we can do. This next tip is one of my favorites, especially if you're a cycling woman. If you don't have a cycle anymore, you can still do this, and they say it's beneficial. But you do, from the day you start menstruating to day 14, so to ovulation, you do seed cycling, and you eat mostly flaxseed and pumpkin seeds, and then sesame seeds and sunflower seeds on days 14 through 28 of your cycle. What that does is it just helps with that actual natural cycle that we do have, and can prevent that estrogen dominance. So lastly, we're going to talk about metabolic health and cancer. And again, all of these things are just really interconnected, because this is going to be a lot of repeat of kind of what we just talked about. But metabolic syndrome has a lot to do with, a lot of people find that if you have abdominal obesity, you have fatigue, high blood sugars, low HDL, and high triglycerides, you probably have metabolic syndrome. But again, it's linked to a higher risk of cancer in those cancers that you see there. So one of my favorite things is to teach people how to hack your metabolism. What's incredible is we think that, again, we can't have all the things that we love to eat anymore, and that's not true. We just learn how can we still eat those things but not totally, sabotage our health or diet or whatever. So in this picture, you will see that, no, you're good. You're good. Okay, so if you see the line, the tan bar, that's basically where we want our blood sugars to be, okay? But as you see, the red line is basically way outside of that area, okay? When we have blood sugars doing this all day long, that's where the trouble lies, okay? And so what we want is the green line is kind of staying these low waves, right? So one way that, several ways that you can hack your metabolism is one is food order. And that would mean eating fiber first, so your veggies and that kind of thing first, protein and fat second, and save your carbs for last. So you still get your carbs. That's cool, right? So many people think that, I can't eat carbs. Yes, you can, but you just have to know kind of how to eat them. The other thing I talk about is don't eat naked carbs, so you always dress your carbs with protein, fiber, and fats, and doing an activity after a meal like a walk for 5 to 10 minutes, or some women that clients that I have, they're like, I just do squats at my desk. So squats is an option too, and even a salad starter. So we're gonna go to the next slide and just kind of show how this works. So the pink area is where we don't want to be, okay? The pink area is getting too high of blood sugars, and again, that raises our insulin, causes hyperinsulinemia, and causes inflammation, all those things. So, as you can see here, if you have the pasta and then the broccoli, it really spikes your blood sugar. But But if you have the broccoli first, remember food order, that fiber first, and then the pasta, you don't even get into that bad range. Pretty cool, right? So let's look at the next one. I picked this one because I love peanut M&Ms, and if you love peanut M&Ms, just don't have them maybe in the middle of the afternoon with just them alone. What they're saying here is if you add a protein, veggie, or fat to a meal, it lessens the effect of the carbs. So the first picture is M&Ms on an empty stomach. Of course, it goes into that range. And the second picture is M&Ms after dinner, which was like a chicken salad, plus they had a walk, right? It didn't even get close to the red range. So again, you can still have those things. It's like just learning these little hacks. So how to become more metabolically healthy? Again, just balancing those blood sugars, restoring your gut health. Again, that dysbiosis, that imbalance of bacteria can really lead to a poor metabolism. We have to remember that our good gut bugs actually aid in digestion, carb digestion too, nutrient absorption, and regulate our appetite, where the bad gut bugs pretty much do the opposite. They hinder fat burning, increase inflammation, and promote weight gain. Eating more whole foods, always focusing on good protein sources, walking after meals, ensuring proper sleep. I always say it's not great to eat within 3 hours of going to bed because our liver has so much work to do at night. And then if we're eating right before we go to bed, it has even more work, and then it can't get to the duties that it really needs to do. So that is just a good hack as well, as trying to not eat within 3 hours. But of course, lowering your stress. But I just want to leave you guys with this. I know there's a lot of information in very little time, but learning to not ignore your symptoms. And again, I always think back to my friend Jenny, because she just always says, I just ignore too many things. If you feel off and you get labs and they tell you everything is fine, trust your gut. Because that was me. I was struggling with fatigue and all these things, and the doctors kept, doing labs and saying, you're fine, Sarah, you're fine. And I was like, I'm not fine. I know something is wrong with me. And when I went to functional medicine doctor, they started working with me on nutrition and all these areas, and that's when I started feeling better and kind of got my a lot of my energy and whatnot, vitality back. So again, we have to get to the root of the issue. If you want to learn more, I do have a podcast. It's called the Improve Energy for Busy Moms podcast. It talks a ton about gut health nutrition strategies. I also have, if you want to learn more about my lose weight, grow closer to your, it's supposed to be called, I messed that up. It's called the Gain Health, Lose Weight, Grow Closer to Your Creator program. And you can book a free call with me at callwithsarah.com. But I invite you to come to my booth. It's the booth with absolutely nothing on it. And I will talk to you more in the lunch hour if you want to visit. That's basically it. Thank you.
Thank you. Isn't she wonderful? So full of knowledge.